Hi, good morning, everyone, and welcome to McGill Dementia Education Program's Caring Conversations. This is a free community outreach initiative to provide virtual support to care partners of people living with dementia. So the McGill Dementia Education Program offers a comprehensive range of free resources to educate and support people living with dementia, family and informal caregivers, healthcare professionals, and medical students, as well as the public at large. One of our most important resources is Dementia Your Companion Guide, which is now available online for free in 10 languages, with 2 more languages to be launched in January. Printed copies can also be obtained on Amazon. You can find many answers to your questions as well in the extensive library of McGill Cares webcasts. We have over 100 episodes posted on our website at the moment. And Caring Conversations is an initiative of the McGill Dementia Education Program that is supported by Petro-Canada Caremakers Foundation. Now let's meet today's moderators. Lucy Baralek received her Master of Social Work from the McGill University School of Social Work. She's developed evidence-based training for seniors and caregivers and has lectured in the field of social gerontology and presented at major conferences. Her research studies have been published in numerous journals. Ms. Baralek received the Queen's Jubilee Award for her role in developing a national coalition to support caregivers in Canada. And Joanne Besner is an educator, professional coach, and caregiver. She received her Bachelor of Social Work and Master of Business Administration from McGill University. Her 35-year in public community healthcare in Quebec spans many roles, including frontline case manager, clinical supervisor, manager, research, and trainer. Today's topic is safe use of medications for seniors and caregivers. Lucy and Joanne will explore the side effects of medications, including the risk of falls. They will also discuss common mistakes that people sometimes make when taking medication. We ask that you please keep your microphones turned off. We'll unmute people as needed once we open the discussion. We also want to let you know that this webinar is being recorded and will be posted on our website, but we'll stop the recording at 11 a.m., in an hour. And then you'll have 30 minutes at the end of the session so that you can share anything that you might not want to have recorded. All right, so thank you so much, Joanne and Lucy. Please go ahead.
Hey, thank you, Diane, so kindly for your introductions. So what are the benefits and risks for seniors and caregivers? Modern medicines that we have access to today have contributed to our longer lifespans, improved our health and quality of life. Medications are the single most common treatment for many diseases and conditions seen in older people and persons with chronic disabilities. Medicines now not only treat and cure diseases that were untreatable just a few years ago. We don't have to look far. Look at what happened with coronavirus and before that with AIDS. So they aid in early diagnosis of disease, prevent life-threatening illnesses, relieve pain, and allow people with terminal illnesses to live more comfortably at the end of life. However, for older adults and people with disabilities, medications, prescription, over-the-counter, alternative medicines can be a double-edged sword. At times, they can cause more harm than benefit. When not used properly and safely, medications can have serious consequences. The good news is research has shown that medication-related problems are often preventable. You and I, as caregivers, can play a key role in helping to identify when and if it is a medication-related problem. Why is this so important? Because medication-related problems often cause hospitalization, and about 1/4 of all nursing home admissions are due, at least in part, to the inability to take medication correctly. And that's why today's topic is so important. I also want to add that this topic is very personal to me. I have a family member that was prescribed powerful medications decades ago and has suffered drug-related consequences their entire life. The side effects have ended up to be worse than any illness they were ever treated for. Add to that the changes that occurred with their aging into their 80s. For my person, any admission to hospital was always so much more complicated because before any medical intervention or treatment could be done, the medications had to be sorted out. I wish I had known then what we will be sharing with you today. So Diana already mentioned a bit what we're going to cover, but we're going to start with the numbers and look at how much medication are we really taking in Canada. And of course, we're going to look at what does this mean for those who are impacted by dementia. And then we'll cover the side effects, common mistakes, risk of falls, hospitalization. And we're also going to talk about the importance of the role of your pharmacist. So what medications exactly are we talking about? So of course, we're talking about prescription drugs, those that the doctor gives you. But what about over-the-counter medications? How often do we take these? And these are all from my cabinet. Aleve, Tylenol, here's one of my favorites. Sinutab for allergies or colds. And then, of course, some of us take natural products. Here's one of mine. Or something like this, over 65 detoxifying nutrients. So medicine can come in the form of tablets, capsules, pills, liquids. What about cough medicine? Puffers, inhalers, some here, drops, needles, suppositories, and even ointments. And the reason I'm showing you all these is sometimes we may not include all those things in our list of medications. So let's look at some numbers, some statistics. And Lucy and I dug into one particular study called Drug Use Among Seniors in Canada from 2016 and want to share some of the key findings. In 2016, seniors were prescribed an average of 6.9 different drug classes over the year, compared with 7.1 in 2011. So an average of 7 drugs. You can see how easy it is to get to that number. And so it's remained pretty stable over the last 15 years. Approximately 1/4 of seniors were prescribed 10 or more drug classes in each year. Low income and rural living seniors were prescribed even a greater percentage of medications. And I just want to ask you a question. I'm going to quiz you, and you can put the answer in the chat or you can say it out loud, but I'm wondering if you can guess. What kind of drugs do you think made up 5 of the top 10 most prescribed drug classes in each year? So think about if you know the answer, you can shout it out, or you can write it in the chat. I'll give you a second. So the answer to our question is cardiovascular drugs make up half of the 10 top prescribed drug classes for heart. So if you're taking those medications, you are not alone. The number of drugs, let's take a look at actually the risk of hospitalization. The number of drugs being prescribed to seniors was the factor most responsible for hospitalizations related to adverse drug reactions. Seniors who were prescribed 10 to 14 drug classes were over 5 times more likely to be hospitalized for a drug reaction than seniors prescribed between 1 and 4 drug classes. Seniors prescribed 15 or more different drug classes were 8 times more likely. And the meds are usually kept in dosette boxes. So, sometimes you can start with this. This is actually mine and holds about 3 medications that I take in a day with my vitamins. This, for example, is a dosette box divided into 4 times a day. This was my late father-in-law's dosette. And for those who take multiple medications, you may be familiar, I don't have one here, with a Dispil pack. It's almost the size of a page. And you just punch out the medications at the time of the day. So some of you might be familiar with those. So what's going on in long-term care facilities? Some of the key findings were that seniors living in long-term care were prescribed more drugs than seniors living in the community. 9.9 compared to 6.7 drug classes. That's almost 10 each. The use of opioids was higher in long-term care. Residents were prescribed opioids twice as often, almost 40% compared with 20%. And I want to take a minute to talk about opioids. Opioids are so powerful and extremely addictive. They are meant for acute pain and should be used for short terms. However, this has not always been the case. And these meds have been overprescribed and misused for decades. And I'm sure many of you may have heard or seen the reports on opioid use in Canada. It's a huge topic. And I can recommend, if you're interested in knowing more series, an incredible documentary series called Dope Sick. And maybe Diane, you could put it in our chat. It's DOPESICK. If anyone is interested in more information on opioid use, the history. The bottom line is that some of our seniors may have been the victim of overprescribing and mid-use over the years. So just also, antidepressants were prescribed in long-term care more than 3 times as often as those in community, 60% versus 19%. So, this is staggering, and these numbers. So later on in our discussion, if time permits and you'd like, we can have a discussion or toss around why we think the numbers are so much higher in long-term care. So last numbers we're going to look at, older adults are nearly 7 times more likely than younger persons to be hospitalized after an emergency visit, so to be admitted. But most of these hospitalizations are due to just a few drugs that should be monitored carefully to prevent problems. And I want to tell you about some of them. They are blood thinners, many people on blood thinners such as warfarin, diabetes medications like insulin, seizure medications like phenytoin, and prescription opioids are some examples like I've just discussed. So what do we conclude from the research? Well, of course, many older adults depend on multiple medications to provide relief, control their medical conditions, and help them lead independent and meaningful lives. But when not taken properly, it can sometimes cause other health-related problems. So you're going to hear us say this a lot during this webinar. Medications must be taken properly. So just some good news, there has been a slight decrease in potentially inappropriate drug use. Chronic use of inappropriate drugs as defined by the 2015 Beers criteria. And if you haven't heard of this, the Beers criteria is a report done out of the USA, and it decreased from 33.9% in 2011 to 31% in 2016. So that's really going in the right direction. The use of both antipsychotics and benzodiazepines decreased, likely due in part to ongoing initiatives to reduce their use and a lot more education. So what does all this mean for caregivers of those with dementia? So let's just remind ourselves about dementia. We know it's often referred to as a neurocognitive disorder. This is the new language that's being used in the medical community. Dementia is chronic and progressive. There is no cure. It means a deterioration in cognitive functioning. It affects the ability to process thought, memory, thinking, orientation, oriented to time, to person, to place. Comprehension and calculation are reduced, and it affects a person's learning capacity. It affects their use of language, and very important, it affects their judgment. So the impairment in cognitive function is also often accompanied with decreased emotional control, social behaviors, or motivation. Especially judgment, if you think about it, it's already so impacted by dementia, and even more so by medication usage and impacts. So this isn't today an information session on what medications to suggest or use by any means, but we just wanted to mention some of the medications that may be in your person's treatment plan. So for Alzheimer's disease, although no cure, some are prescribed medications to slow the rate of cognitive decline or help with symptoms like changes in language and thinking abilities and movement. So some of the medications your person might be taking are, and they give both names, the brand and generic, but we're looking at Aricept, Remenil, Exelon, and Ebixa. And of course, there may be others. And remember again, dementia is the umbrella name, so there are very many types, and some others are Parkinson's that we've talked about, frontal temporal dementia, and Lewy body. So your person may also be taking medication specific to those illnesses and mixed dementias to slow down this disease or treat symptoms and behaviors. So on top of that, many people already have chronic conditions before they are even diagnosed with dementia. So at the onset of diagnosis, you or your person may already be taking certain medications for heart disease, stroke prevention, eye disorders, arthritic issues, sometimes recurrent infections like UTIs. Or in the future, they may be prescribed more medications. On top of this, we need to be aware that there are effects of food and beverage on the medicine we take. We need to be aware of drinks, supplements, and herbal products that have impact on medications. For example, some antibiotics are not absorbed well when taken with foods, drinks, or medicines that contain calcium, magnesium, or iron. Antacids like Tums, vitamins, dairy products contain these. Also, certain drinks like, excuse me, grapefruit juice can change how your body processes medicine. These changes can cause medicine to build up in the body. And you can ask your pharmacist about what foods, drinks, or supplements to avoid when you pick up your medications. You know, they give you an information sheet for every new medication that you receive at your pharmacy. And I've noticed in the last few years, I hope you've been having the same experience. When you pick up a new medication, it's not like you just get your medication and pay. My experience is I get my medication, they open the sheet, we read the sheet, and then they always say, your pharmacist wants to see you and go to the window for a consult. So I find that really, really best practice, and I encourage you, I know you might be rushed, but really meet with your pharmacist and make sure you're learning everything about your medications. So to make matters even more complicated, medications work differently in older adults. So you might be taking the same medication, that hasn't changed, but as we get older, our bodies change and they react to that drug differently than when we were younger. The aging process can affect how medication is absorbed in the body, and we talked about that, and how long it takes to flush it out. Medications used to treat one condition may also make another condition worse. And with several medical conditions, medications can interact poorly with each other. So older adults with memory problems already may have worse symptoms due to the medicines that they're taking to treat their other conditions. I can't underscore enough how important it is to have a GP or a geriatrician or a psychogeriatrician to coordinate and look at the big picture of medications. So, you know, I hope you're not overwhelmed. We've shared a lot of information, but the next question is, what do you do with all this information? So for next steps, I'm going to pass you on to Lucy Barilak for the next part of our presentation.
Thank you so much, Joanne. You know, there's so much to absorb, and this is why we felt it's so important to talk about this topic. So let's talk about side effects. What kind of side effects could somebody expect? There could be dizziness, which can cause falls, obviously. More mental confusion. Dehydration is a big one. There could be diarrhea, constipation, rapid heartbeat, sweating, pain that was never there before, aggressive behavior sometimes, and there could be a boost or diminished sex drive. So, if the person you are caring for suddenly starts behaving in any way in any of these situations, could be also inappropriate behavior, verbally, physically, sexually, it's really time to call the doctor. Explain to the doctor what's happening. Keep in mind that the behavior may be caused by certain medication or other physical problems, as Joanne was saying, like an infection that you're not aware of. So when going to the doctor, bring all the medications with you, prescription, over-the-counter, vitamins, supplements. Sometimes we forget about those and we just bring the prescription ones, but it's so very important that you bring all of them. Now, before we go to the next slide, I would like to ask the audience a question. And you can either raise your hand or put it in the chat. Where do you think is the safest place to keep your medications? Going once, twice? Okay, so let's take a look at that. Where is the safest place? It's important. So there we go. Thank you. And there is something in the chat before we go further. Is there?
No, there's what do you do if you don't have a family doctor? That's the question.
That's a big one.
Yeah. So, but I think it's a great question. I'm gonna jot it down,
Yes,
and maybe we can tackle that first in the discussion.
thank you. All right, so let's look at where is the safer place. So I want to tell you, do not store medicine in the bathroom or in the kitchen because they can be affected by dampness and heat. So even though we have medicine cabinets in the bathroom, don't put your medication there. Do not store medicine in any place that is too warm, like near a stove, heater, or in the sun. The best place to store medicine is in a cool, dark, dry, and secure place. Such as the bedroom is a good place to keep that. Note that some medication must be kept in the refrigerator, obviously. Try to minimize the number of times the bottles or vials are open to reduce exposure to moisture. Weekly pill reminder boxes can actually help. Try to keep all medicine together for convenience sake so that you don't have to run around. One is here, one is there. Keep it together. Keep medicine away, obviously, from children or pets. And maybe if somebody is dealing with someone with dementia, it might be a good idea that you use a locked box. All right, so I really want to talk now about medications and the risk of falling. This is a big one. So any drug that causes the falling can increase the risk of falls. So as I was saying, if the medication, if there's dizziness, drowsiness, hypertension, low blood pressure, Parkinson's disease affects, if they're shaking, poor mobility, that could be a risk factor. There are gait disturbances, poor muscle control that causes clumsy, involuntary movements, vision disturbance, not seeing well, double vision. I also want to add even hearing could be an issue. So any drug that causes these effects can increase the risk of serious outcome if a fall occurs. So osteoporosis or reduced bone mineral density can increase the risk of fracture if this is what you have, if a fall occurs. Now bleeding risk increase the risk of hemorrhaging if a fall occurs. Now, I also want to say that if the person you are caring for is displaying any signs of side effects like dizziness or drowsiness, the chances are that they may not have good judgment. The medicine side effects may increase their confusion, their behavior. For example, if they're trying to get out of the chair and they feel dizzy or drowsy, they may not have the good judgment to sit back down, but they can get up and may fall. Let's look at some of the very interesting stats, World Health Organization, and specifically the Public Health Agency in Canada. So what they're saying is that 1/3 of older adults fall each year, 32% to 40% for those 70 years or older. That's high, and highest in 80 years and older. In Canada, falls are the leading cause of injury-related hospitalizations and injury death among people aged 65 or older. Injuries from fall reduce older adults' quality of life. It can increase caregiving demands and participate admissions into long-term care. The cost of treating fall-related injury is high, and the baby boomer age by 2040, older adults are projected to make up close to 1/4 of Canada's population. The pace of growth of the group aged 85 or older is expected to be particularly steep. Therefore, it's essential to monitor trends and burdens of falls among Canadian older adults. So, if we look in the future, the seniors are really increasing, and we do have to look at all these issues, especially when we talk about medications and falls. Now, here's a staggering stats that I want to share with you. So from 2018 to 2019, and then from 2019 to 2020, the number of fall-related hospitalization of older adults increased by 47%. So we really have to be aware of that. So as we're talking about this, we would like to kind of look at all of us, are we at risk for falls? So let's take a look at that. So if you or your loved one had a slip, trip, near fall, or fall in the last 6 months, you might be at risk for falls. Are you or your loved one taking a drug that can cause side effects such as dizziness, difficulty walking, etc.? Are you or your loved one taking a high dose of drugs? As we're saying, many drugs, more than 4 or 5, some of them could be. Are you or your loved one over the age of 65? If yes, patients may be more sensitive to adverse drug effects because of changes in the body. As Joanne was explaining, it absorbs, how it absorbs and how it eliminates from your body. Are you or your loved one taking more than one drug that increases the fall risk? Are you or your loved one at high risk of falling from other non-drug reasons? For example, you have poor mobility, you're using a cane, you're using a walker. Is it difficult for you or your doctor to monitor for an adverse drug effect? Sometimes it's difficult because you're taking so many medication. Does your loved one suffer from any form of dementia? So here are all the risk factors for potential falls that you should really be aware of.
So on that note, Lucy and I want to invite you to take a fall risk quiz with us here today. And I'm going to emphasize again, something I always said to my father, Dad, a fall can change your life. And I just want those words to resonate, because everything can be going along stably fine. You fall at home, outside on a curb, you fall in the bathroom, that can change everything. So we are inviting you, this is not obligatory, but if you would like, grab a pen and a paper at home. We're not going to be doing this out loud. We're going to be giving you the time to do it together. And you can decide, there are 12 questions that I'm going to ask you. And you can decide if you want to do this quiz for yourself, if you feel you're at risk of fall, or if you're caring for someone, if they are at risk of falls. Or you can decide, if you're brave, to do it for both of you at the same time. And if you do that, I would suggest that you take your paper and just make a line down the middle so that you don't get the two answers mixed up together. So grab a pen and paper if you don't have one. Now, if this is too much now, just a reminder that this will be posted on the website, and you can come back to the Dementia Education website of McGill, and you can do this in your own at your own pace. But let's take the time now. It's not going to take us too long. So I'm going to ask you a question, and are you or the person you're caring for at risk of falling? So number one, have you fallen in the past year? And if you have, and you're doing it for yourself, give yourself 2 points on your paper. So 2. And for your caregiver, if you're doing it for them as well. If you have fallen, again, this is a huge risk factor for another fall. You have to be particularly vigilant. Next question. Do you use, or have you been advised to use, a cane or walker to get around safely? So if you're answering for yourself and the answer is yes, give yourself 2 more points, or 0 if the answer is no. If you have been recommended to use a walking aid and you're not using it, and we know sometimes people can be reluctant to do so, please talk with your physiotherapist or your doctor about that. Question 3. Do you sometimes feel unsteady when you are walking? If the answer is yes, for you or the person you're caring for, give yourself another point. 4th question. Do you find yourself steadying yourself by holding onto furniture or the walls when you're walking in your house? If the answer to that is yes, give yourself 1 point. Next question. Are you worried about falling? If the answer is yes, give yourself a point. The same for your care receiver. Do you ever push with your hands to stand up out of a chair? If the answer is yes, give yourself a point for your care receiver. So that's the first 6 questions, and we're going to go on to the next 6 questions. So question 7, do you have some trouble stepping up onto a curb? If the answer is yes, give yourself a point. Question 8, do you often have to rush to the toilet? Again, if the answer is yes, give yourself or your caregiver another point. And remember, if you are rushing to the bathroom, make sure you have a clear path. It's free of clutter. Next question. Have you lost some feeling in your feet? Do you have numbness in your feet? If yes, give yourself a point. Actually, I suffer from this, and that's a risk factor. Next question. Do you take medication that sometimes makes you feel lightheaded or more tired than usual? So if you're answering for yourself, give yourself a point. For your caregiver, care receiver, give them a point. Do you take medication to help you sleep or improve your mood? If yes, give yourself or your care receiver another point. And final question, do you often feel sad or depressed? So if yes, give yourself or your care receiver a final point. So now, for whomever has taken the quiz, add up your points, add them all up, separately add up your care receiver's points, and make a total score. If you have scored 4 points or more, it doesn't take much. You may be at risk for falls, and it really is a sign to talk to your doctor or healthcare provider or CLSC team for any questions you may have. So I hope I've given you enough time to do the quiz. Even if you've done it in your head, the questions are good ones to ask yourself, and you can always go back to the website. So now some tips, and I'm going to pass you back to Lucy.
Thank you, Joanne. So I did the little test myself and I scored well. So I'm really happy to have had the opportunity to do that. Okay, so tips. But what I want to say, because seniors take more medication than younger population, they are more at risk for side effects and falls. When you get a new prescription, ask the doctor and pharmacist if this drug has any side effects of possibly becoming dizzy, drowsy, sleepy, or forgetful, which can escalate a potential fall. So the tips are, so falls are the main reason older adults lose their independence. Ways to prevent falls and injuries from falls, maintaining independence and prompt healthy aging. So one of them, the first one is to be active. Daily activities can give you the balance, strength, and flexibility you need to stay healthy. And that could mean just walking a lot or one of the things that I do is wherever I'm going with my car, I park a little bit further away. And so that I have a little bit more chance of walking those extra, I try to do my 10,000 steps. Use medication wisely. Medications can affect your alertness, balance, and stability. Review your medications with your healthcare provider or pharmacist every 6 months. Do a home safety check. Now, this is really important. Ensure good lighting, particularly on stairs. Take your time, move at a pace that is comfortable for you. And the other one is really eat a well-balanced diet, follow Canada's food guide, and enjoy a variety of healthy foods each day. Calcium and vitamin D are important for bone health. Ask your doctor if you're getting enough. The more risk factors a person has, the greater their chances are of falling. So let's look again at the 5 things you can do to prevent the fall. Exercise daily and build strength and improve balance. Now, as you don't have to join a gym, there's lots of free videos on the internet of beginners exercise for seniors. It can also be done in a chair, but it's so important to get that exercise and so important for the person you are caring for as well, so that they can participate. However, before starting any new exercise, please speak to your doctor first. Now, wear safe footwear, obviously, to make sure that you're well balanced. Now, make your home safer. Now, we'll go back to that. Remove all clutter and tripping hazards. Add rails on all stairs and grab bars in the bathroom. Now, we're lucky in Quebec in the way that we do have local CLSCs. You can definitely call your local CLSC and have a professional come into your home and assess the bathroom for the person you're caring for and for yourself. And even giving you, most of the time, they'll even give you tips about certain things that are safety hazard. So don't forget to use that resource. Have regular eye checkups, and I would go as far as also saying hearing checkup is also very important. It's also important to make sure the person you're caring for does wear their glasses and that obviously they're clean and they're wearing their hearing aids. Talk to your doctor or healthcare provider to learn more about your risk. Now, I want to also go back to the CLSC. There's fall prevention programs. So there's lots of resources out there to help you strengthen yourself and the person that you're caring for. All right, so let's change the topic for a minute. Now, pharmacist tailored care. I truly believe that your pharmacist is one of your best friends in the healthcare system. For older adults, and be helpful to develop a relationship with a pharmacist and use the same pharmacist regularly. As the pharmacist learns about, individually about your needs and the needs of the person you're caring for, they can help provide consistent care and help prevent drug-related problems. So pharmacists, they supply drugs to patients in ways that are physically accessible to them, such as easy open bottles or pills without wrappers. So you can talk to your pharmacist if you have a difficult time with that. Having drug labels and written material in large type and in the patient's language, and it could be French or English, so they are easy to read. Now, that I did with my mom, and it was really, really helpful when she can actually, at the time, still see the drugs and be able to administer it herself. Cutting pills, if they are too large to swallow, never cut the pills yourself, because you never know how to cut it properly. There's a certain scissor that needs to be used. It's the pharmacist's role to give you information you need about each of your prescription and how to take them. As Joanne said, always go for a consultation, read very carefully the instruction paper that you receive. It even tells you what foods you can and cannot eat with certain medication. It's important to use one pharmacy if at all possible. Okay, so we want to talk a little bit about what you need to do to know about medications when a senior is discharged from hospital. So the first thing is to ensure that the person has an updated and current list of all medications, including prescription drugs, over-the-counter medication, and supplements. You know, it's not an easy thing when somebody goes into the hospital and our healthcare system. So you have to really be very cautious when they're going to be discharged of what medications that are changed or included. Include details in the discharge plan. There should include details such as the medication name, the dosage, how frequently, and the reason for each medication. Ask, why are you prescribing this medication for? Make sure that you understand the purpose of each medication and how to take it correctly. Discuss potential side effects and what to do if they experience any adverse reactions. Don't be afraid to ask questions. You're advocating for your caregiver and for yourself. Be aware of any changes made to the medication list during the hospital stay. Usually, most of the times, they do change it around because things change. Maybe there's a new disease that has occurred. Understand why these changes were made and how they might affect the person's health. If new medications are prescribed, ensure that you understand the reason for these additions and how to fit it into the overall treatment plan. Verify if any medication prescribed in the hospital interacts with existing medication. This is a problem that needs to really need to look into that. Now, the other thing is understand if any medication were discontinued during the hospital stay and the reasons for this discontinuation. I remember when my mom went into the hospital, all of a sudden, all the medications were changed, and I really was very confused about that and needed to have a clear understanding what was going on. Now, schedule follow-up appointments with the person's primary care physician and as any specialist as needed. And maybe it's a good idea to even start doing that prior if you know that they will be discharged a few days before. As we know, it takes time to get an appointment these days. Bring the updated medication list to those appointments, obviously. Provide the updated medication list to the person's pharmacy to ensure accurate dispensing. Check if there are any changes to insurance coverage for medication if you have any private insurance coverage. Now, if the person requires assistance with medication administration, ensure that you or your family members are trained on proper techniques. Now, this is important. Properly store medication as directed. We talked about it. It's very important where you store the medication. Make sure you know what to do in case of a missed dose or if they are experiencing medication-related emergencies. Now, this can happen often. You either forget to take a medication, you missed it. The best person to call, I have to say, is the pharmacist. They'll tell you at that point whether not to worry about it, wait until the next time you need it, or they'll say to you, take it as soon as possible. And it's always very good to provide emergency contact numbers for for all your healthcare providers, just in case. So we said an awful lot of things today, a lot of information. So let's look at the 10 takeaways from today's presentation. So as we reported, approximately 1/4 of Canadian seniors, this is from the report of 2016, were prescribed 10 or more drug classes in each year. Now, these are prescription medications. So if you're taking anything over the counter, as we said, it can add up to 15 and 20. So please be very conscious about that and make sure that the pharmacist and doctors knows all of them. Medication can cause side effects that may increase confusion and impact behavior. Many times, we didn't talk a lot about that, but the behavior doesn't only have to do with being dizzy or being, they could become aggressive, they can become withdrawn, very quiet, very sleepy. Drugs can increase the risk of falling. Practice fall prevention. Now, this is a big one, not only about medications and falls, but just in general, as we age, we have to be really careful about not falling and doing some prevention. For those with dementia, those side effects pose an even greater problem, obviously due to the lack of their judgment. The more drugs taken can pose a greater risk of hospitalization. If you remember from what Joanne was saying, that going to the emergency many times, it has to do with adverse reaction to a medication and you get hospitalized possibly. Be especially vigilant about medication following a discharge from hospital. Medications need to be taken properly to work, so be vigilant about that, have a calendar, set your alarm, whatever it takes to make sure that you take it properly. Follow routine and finish medication. This is very, very important, especially with antibiotics, because usually after a couple of days, we start feeling better, your throat's gone, your earache, but the disease is still there, the infection. Store medicine in a cool, dark, dry place that is secure. And consult your experts, especially your pharmacist, to make sure that you have a really good relationship with your pharmacist. And with that, we would like to now let's have a caring conversation, an opportunity for you to ask questions, to talk, and to share some of your tips that you have that you would like to share with others.
So Diane, is
I
there
have a question.
anything in the chat? Oh, go ahead, please.
Yeah, I have a question. When you're saying talk to your pharmacist, the problem I find is this, that these days the chains, there are so many pharmacists, and you cannot, at least I find it difficult to have one person follow the medication for my wife who's suffering from dementia. So every time there's a different pharmacist and the same pharmacist, very difficult to establish a relationship with them.
Well, it's a good point that you're making. That would be difficult. But if you're using one pharmacy, all the information should be there about all the medications that your wife is taking. So if when we say the same pharmacist, we don't necessarily mean the same person all the time. That would be the best. But as long as you use the same pharmacy so that they can go back, they look at all the medications that the person is on. And if you have any questions, they should be able to answer your questions. Ideally, one person would be best, but many times that isn't possible at certain pharmacies. But it's a very good question. Thank you.
Thank you.
Maybe this is a good segue into the question that was posed earlier about the GP, because the pharmacist has a very important role, and you can get to your pharmacist or a pharmacist more easily than your doctor. But really, the role of a general doctor is that's where you really need one person looking at the big picture. And somebody said, what do I do if I don't have a GP? And we know that's a particularly big problem in Quebec and Canada throughout. Excuse me, fighting that cold still. So what do you do if, I can speak to Quebec, you should be, if you do not have a GP, you should be, or your care receiver should be on a list, first of all, and if you're not, you need to phone Santé Quebec or get on that list. That's number one. But again, you're going to wait. So the only other things you can do are go to your local CLSC and make a request for a consult. Some kind of a consult. Now, if you're just taking a few medications, it's less important, but we looked at the numbers. If you're one of those people taking 10, even 5 to 10 medications, 10 plus medications, it's worth just going for a consult in the interim. And then if you're able to financially, there are a lot of private medical clinics. They have different packages. So that's another option if you just have you can't access a doctor. Go for a consult again on all the medications being taken and the interactions. As difficult as it is to get a GP, I think somebody needs to put themselves on mute. There we go. So I wanted to finish with, you may not have a GP, but again, your CLSC can refer you to a geriatric clinic. Those are in the hospitals and they are specialists and they can look at the list of medications. There are usually geriatric units and psychogeriatric outpatient, and they really have a lot of expertise. So that's another alternative. So I hope I've answered your question. Are there any other questions in the chat?
I don't see any questions. I have a question just out of curiosity, because you were talking about how different, different vitamins and minerals can impact your medication taking. So if you take a bath with Epsom salts, because I know there can be a lot of magnesium in Epsom salts, does that impact your medication use at all, or is it so minimal that it wouldn't count? So,
I can only answer that from personal experience, because it's the same thing I would ask a physician. But if you take a hot bath with Epsom salts, I have to tell you, I find that very powerful. And that can cause dizziness or fatigue if you lay in that bath too long. So that's my very unexpert but personal experience answer to that question. And I think, Diane, you bring up something really important. I was looking, because I looked around the house when we were doing this presentation, and honestly, I was flabbergasted at the number of medications I might take, just over the counter, or just looking on Tums and antacids, things I wouldn't have thought about. Looking at creams, there's such a thing as Voltaren cream, and you don't realize that those medications patches that you just put on your skin can have impacts as well. So I think we need to leave it to the experts, but what our job is to bring the information to them.
Yeah, I just want to clarify with that, these patches and these creams, they go into your bloodstream. This is how they affect whatever your pain. And I cannot emphasize enough, before you buy anything over the counter, please go to the pharmacist, your pharmacist that knows all the medications that you and the person you're caring for. Don't buy anything, even Advil or Tylenol. Please ask first. It's life-saving many times.
Thank you. So we have a follow-up on the original question that was posted about, the difficulty in finding a family doctor. And then there's a further question about just finding an English-speaking staff to assist. So I believe you have the right to be served in your English, at least. So I don't know if you can speak to that. Do you have any advice in terms of getting care in English?
Advocacy, advocacy, advocacy. It's funny. We get this question, I think, in every single webinar we have, and it's discouraging. But we have to keep talking about it. I don't know, Lucy, if I don't have any answers except speak up. It is your right. And if you cannot get served, call the ombudsman or the complaint commissioner. We've been hearing in the news that people have made complaints and they have gotten progress. I'm just going to say it's easy for me to say when you're in a hospital or in that situation, you're exhausted. And the last thing you need on top of everything is to have to put your energy into advocating to be served in your language. However, this is kind of where we all find ourselves. And thank you to McGill DEP program for providing this in English. And of course, we want everybody, French and English, to be able to be served in their own language to well understand things.
I agree with that completely. But I do believe that our healthcare workers are very compassionate people. I've experienced something similar to that. My French is not what it should be. And especially when either I'm anxious, it gets even worse. And I experienced that with my mother in the hospital. And the person was speaking French, and I very gently tried to explain that I don't understand as well as I should. And by being very understanding, not getting angry, I could have gotten angry. They made accommodations. So I guess it's exactly what Joanne is saying, but at the other hand, is how do we come across? Unfortunately, we shouldn't have to, because we should be receiving our health treatments in English as well. It's a tough situation to be in.
I just want to add something though, we're talking about French and English, but there are a lot of people who do not speak French and English and speak other languages. And this goes for anybody seeking services. They may not be readily available, but I just want to share my experience. I was in the hospital last week for an appointment, and I heard over the loudspeaker, they were just making an announcement. Is there anybody who speaks Spanish in the hospital? Can you please call this local? So I thought that was a great way to make use of just our general population. The chance is that there may be the general public can help us as well. So that works if you're not served in English as well. Suggest to them, maybe they can make an announcement and somebody will come and help as well.
Right.
Anything else, Diane? Or there's a couple of things I wanted to mention.
Yeah, no, there's no further questions at the moment. So yeah, please go ahead.
I wanted to talk about, Lucy kept saying the list of medications. So just for everyone who may not be aware, you don't have to sit and write out your medications yourself. You can always, if you don't have an updated list of all your medications, the pharmacy will provide a printed copy. You should have multiple copies. And one thing we've talked about, because you can end up going to a doctor and end up being told, go to the hospital, or you can end up having to go to the hospital with very little warning or preparation. So we've talked about this in the past. And again, my father always kept a bag packed. He had a little bag in his apartment and in it, excuse me, were the things he would need if he ended up in hospital. So it's a good thing to prepare that and have it there. One of the things in there should be, he always put a cell phone charger in there, a book, his pajamas, socks, and slippers, but he always had a list of his medications. And of course, he would put his wallet in that bag so that he would just have the Medicare card and what he needed. But it's a good opportunity for us to remind ourselves, having a kit ready with everything you need. Sometimes hospitals say, put all your medications in the bag. That's optimal, but if you can't do that, at least you have the list of what you're taking. So I wanted to take the opportunity to mention that.
I also
Sorry
want
about my voice. Boy.
You need a drink of water, just take a breath.
See, Lucy's caregiving for me right now. And I
Okay.
think we're at the hour. Are we at the, yeah.
I do want to just mention that, and maybe I'll leave that for when we get off the,
Mhm.
I wanted to talk about that.
All right, so I will just say a few words then. Thank you so much, Joanne and Lucy, and everyone who participated at home today. It was such an informative session, so much great information and valuable information. So just a reminder that this has been recorded and it will be posted on our website. I did post the link in the chat. I also posted a link to a questionnaire. We really value your feedback. So if you could take a few minutes to fill in the questionnaire, we'd really appreciate it. Our next episode is going to take place in 2024, January 16th at 10 a.m. And it's going to be questions that caregivers ask themselves. So it's going to be a slightly different format. Lucy and Joanne are going to interview each other and share their own personal experiences on caregiving. So please join us for that session in January. We'll be sending out more information in our newsletter. And we'd like to thank the Petro-Canada Caremakers Foundation for supporting Caring Conversations. It's a project of the McGill Dementia Education Program, which is funded entirely by private donations. If you'd like to join our mailing list to be notified of upcoming programs or resources, please visit our website or email us dementia@mcgill.ca. We hope that you found today's conversation useful, and we wish you a very safe and happy holiday period.